Hello, this is Dr. Richard Fleming, and today is Monday, August 31st, 2020. I invite you to join Mark Pyers and myself tonight on Mark Pyers Real Talk. We will begin at 5:30 p.m. Pacific Standard Time. We'll be talking about the recent discussion of CDC numbers, the protests that occurred in Europe this last weekend, as well as the persistent push for vaccine use in the United States and elsewhere. This will include quite probably discussions about the use of a vaccine under emergency use authorization prior to actually doing safety and efficacy testing. And hopefully we'll get into swine flu a little bit, given some of the interest that I've seen on social media. I encourage you to participate in tonight's discussion and raise questions if you'd like to see a discussion about specific topics and hear the answers to them. Prior to that video talk, video talk tonight, I want to briefly mention the CDC numbers that were released over the last couple of days. There seems to be an awful lot of confusion and backpedaling on a number of fronts regarding the actual numbers. The 186,000 deaths that have occurred in the United States are associated with COVID-19 infections. Looking at only 5 to 6% of the deaths in individuals who had no comorbidities misses the point that this virus, which is targeted on increasing infection and immune responses in people, has literally had a very effective response by killing some 186,000 people. The virus itself, once it gets into the body and starts replicating, initiates an immune response, which is what human beings should do to try to clear the virus. The fact that there are so many individuals with comorbidities in the United States and around the world signals the serious health consequences of people in general. But it doesn't negate the fact that these individuals died because of an immune response precipitated by COVID-19. And it doesn't alleviate the responsibilities of the medical community for having failed to address the immune response by proper use of ventilators for people with ARDS, which is the inflammatory response that occurs with COVID-19 and other health problems. And it doesn't alleviate the responsibility of the medical system that failed to treat the inflammatory response both at the 4 to 5 initial acute innate T-cell cytotoxic period, or the 7 to 10 day later adaptive humoral antibody response. It is the failure to address this inflammo-thrombotic response that has caused the deaths of over 186,000 Americans and many more, hundreds of thousands worldwide. It doesn't mean that the virus is not responsible for that, because if the virus wasn't there, there wouldn't be this immune response. We do see the same thing with influenza and other infections. It simply hasn't been brought home to everybody like it has with COVID-19. The utilization of vaccines is not going to change that. It's going to only accelerate the rate at which people develop an immune response, with many thousands, perhaps hundreds of thousands of deaths as a result of the vaccine. Again, I look forward to your participation in tonight's discussion with Mark Pyers. So that's MarkPires, Real Talk. And you can find that on YouTube. And we will begin at 5:30 p.m. Pacific Standard Time. Look forward to seeing you there and answering your questions.